Here's an x-ray that we took at a checkup appointment where we can see that there are numerous areas of interproximal decalcification between the teeth. In my opinion, it is not appropriate to do fillings on these lesions unless we can see clear radiographic darkness into the dentin. Using this cutoff, we note two areas that require fillings, the upper right first premolar and the lower right first molar. In this video, we will be restoring the lower right first molar with a standard class 2 dental restoration. We're going to begin by applying a rubber dam from the second molar to the midline of the quadrant to isolate the tooth that we're working on from the rest of the mouth. And then we're going to begin accessing the tooth decay with a medium round diamond burr on a high-speed handpiece. And once we can see the tooth decay, we're going to start removing it with a small round carbide burr on a slow-speed handpiece, removing all of the soft tooth decay until we're back on hard tooth tissue. Then we're going to open up our buccal and lingual contacts. Check in the mirror, we can see we have no more decay, but we do need to open up the gingival contact. So we're going to do that with a Fisher burr as well. And we're pretty much ready to go here. No more decay, open contacts. Just going to go in one last time with a slow speed and round off any sharp internal angles. Ready to restore the tooth, so we're going to apply our matrix band and stabilize it with a wooden wedge. And then we're going to apply our separator ring. And I like to apply these separator rings as apically as possible and then give it a good shake to ensure that the teeth are as wedged apart as possible for the tightest possible contact. Going to burnish the band against the neighboring tooth with a ball burnisher, give it a rinse, etch the tooth for 5 seconds with phosphoric acid, rinse and dry it off, and then apply our Equia Forte material. I like to overfill my preps and then tamp them down with a moist cotton pellet to ensure that the restorative material is well adapted to all the margins. We're going to wait 4 minutes for it to set and then disassemble our matrix. And I'll always just use a pair of Howe pliers to remove the sectional band. And then we're going to begin removing the excess material with a large round diamond and then refine the reduction of the excess material with a large round carbide until we're back on the original margins. Going to remove the rubber dam and check the bite. Have the patient bite down and grind hard. No high spots, so we're going to apply our varnish material. Give that a cure. And then check the floss, or check the contact with some floss, and then send the patient home.